Hi, I'm Dr. Seth Force. I am the Kamal A. Mansour Professor of Surgery and Chief of Thoracic Surgery at Emory University Hospital in Atlanta, Georgia. When we find a lung nodule, particularly a solitary lung nodule on a CT scan, be it a screening CT scan or a CT scan that was performed for other reasons, there are key features in the patient's history, in their social history, their past medical history, and key features of the imaging that will direct us for the next steps and make us concerned or not as concerned about whether it's a cancer. So obviously, if the patient has a smoking history, particularly we know that patients who are considered high risk for lung cancer are between the age of 50 and 80 or 85 and have over a 20-pack year history of smoking. That means they've smoked at least a pack a day for 20 years. Those patients actually qualify for screening CT scans, and anybody who fits in that category should get a screening CT scan that is actually covered by insurance. Certainly exposure to significant secondhand smoke is also a key past feature, history of other cancers, and then features of the CT scan. So the size of the nodule is particularly important. If it's a very small nodule, certainly under a centimeter or just a few millimeters, that may or may not be as concerning for cancer, or maybe something that we can follow versus trying to go directly for a biopsy or surgery. We talk about whether the nodule is spiculated or smooth and round. So spiculated means that it's got little tendrils like a crab claws coming off it. That's why cancers are called cancer, because of the astrologic sign for a crab. And some people, I guess, a long time ago thought that the spiculations looked like crab legs coming off a crab, whereas perfectly round, smooth nodules are less likely to be cancer. Nodules that are completely calcified are less likely to be cancer. Nodules that have a little bit of calcifications in them, that can be a risk factor for cancer. And if the scan is done with intravenous contrast and the nodule enhances or somewhat lights up or glows on the scan, that's more concerning for malignancy than a benign lesion.